My name is Kazko Kawai. I represent Voices for Lively Spring. Last May, I invited Mr. Hiroaki Koide of Kyoto University Research Reactor Institute to New York and presented him on 2 occasions. A talk by him on May 3rd and a press conference on the following day. The press conference was co-hosted by 3 parties, Mary's Human Rights Now and Physicians for Social Responsibilities and Voices for Lively Spring. And at that time, I had Dr. Andy Cantor from PSR and 2 doctors from Japan, Dr. Junro Fuse and Dr. Ken Nakayama. They participated in the press conference, and the talk and the press conference were webcast by this gentleman with accesses over 13,000, and which surprised even Mr. Koide. And in the press conference, the 3 doctors explained about the danger of the low-dose internal radiation and called for immediate evacuation from the contaminated areas. However, there was no proposal for instructions or means of such evacuations or no information for available doctors in Japan. On the following day, I attended a symposium hosted by University of Chicago, in Chicago, of course, where Mr. Koide and Ms. Ruiko Muto of Fukushima, as well as Dr. Jeffrey Patterson of PSR talked. I learned a lot from Dr. Patterson while chatting with him in a group dinner after the symposium and a field trip to Chicago Pile, which is the experimental research reactor for the Manhattan Project. When I thought about the current Japanese irradiation conditions in the eastern Japan, doctors' networks as well as evacuation support networks must be established as soon as possible. In particular, there is huge distrust on the administration, and we must take actions on grassroots levels to make things happen at all. For patients, primary care doctors are their first contacts, but the doctors really lack in the radiation knowledge. After returning to New York from Chicago, I had to think what to do next after Koide events in New York. In my opinion, the Japanese primary care doctors in private practices might ignore nuclear scientists or physicists, but should be glad to hear what their colleagues, that is, clinical doctors, should say. A while later, I remember that Dr. Patterson was mentioning that he would go to Japan in the summer. I did some research, and I found out it should be for the Hiroshima Congress of the IPPNW. IPPNW stands for International Physicians for the Prevention of the Nuclear War. And they had an annual conference in Hiroshima in August. So I started thinking of having him in a seminar in Japan, maybe just one seminar, or before or after the Congress. He did confirm that he would attend this conference and agreed to speak for Japanese people. Then I started looking for a doctor who can talk about an area that was not very badly, but only slightly contaminated by the Chernobyl disaster. For instance, maybe Germany or Austria. It was not so easy to find the right one, but finally I found Dr. Delte Ziedentopf of Germany. who continued her efforts to support Chernobyl over 20 years. Well, she is also a founding member of IPPNW Germany. So I proposed my plan to activists whom I had worked with on the tsunami debris issues in Japan, and the plan became bigger and bigger. Finally, we decided on the basic idea for an event with 3 sections. Now it expanded from 1 stop to 5. I asked each supporting group to start building locally a doctors network and evacuee support network. There were very nasty obstructions in the planning process, but finally 5 local committees were set up and started preparing for their event. 5 cities were Yokohama in the Tokyo metropolitan area, Shimada in Shizuoka prefecture. Shimada is famous for the tsunami debris issue with a very aggressive mayor. Osaka and Kitakyushu, both with many evacuees from eastern Japan, but the mayors there are willing to burn tsunami debris. And Fukuoka, lastly, where Mr. Koide's talk was to follow our event. Events of this scale usually require at least 6 months of preparation, but we had only 2 months due to the timing of the doctor's visit to Japan in August. There were many irregularities due to a lack of time. Furthermore, 5 local committees had different levels of experiences in event organization, from almost professional to almost novice. Mary Ann De Leo, the director of Chernobyl Heart, made a last-minute cancellation. But I had to find a replacement, and I was able to do so. Irene Zabitko, the Ukrainian American author and documentary filmmaker, accepted to visit Japan and read out her writing on Chernobyl, which you will hear later. I have a handout. This is a small program booklet I handed out to everybody during the event. And this has summary bios of the doctors and the author, and summary of their talks, and some information, additional information and pictures that were presented in the lectures. And the other one with a pink cover, this is the excerpts from the booklet I made to report on the whole event. This has about 60 pages, but this has only 20 for you to keep. I printed not too many copies, so I ran out of these full reports very quickly. And this is one of the very few copies I have at hand right now. So on page, just a moment, page 3, I have a basic program for the event. Section 1, we had a screening of Chernobyl Heart and a reading of an essay by Irene Zabitko titled From Chernobyl to Fukushima. The second section, we had talks by German and US doctors. Learn from Chernobyl was talked by Dr. Delte Ziedentopf of Germany, and experiences of nuclear testing and nuclear disasters around the world was talked by Dr. Jeffrey Patterson of Madison. He's a professor of Wisconsin University, and also he has a private practice. So both of them are clinical doctors, which is very important, I think, to persuade very reluctant Japanese doctors. And the third section, it really depends on the places, but many events had mini symposiums assembling evacuees from Eastern Japan, journalists, lawyers, assembly women, and so on. And also, of course, Japanese doctors who met with many local patients. And at the same time, before the event, we had health consultation sessions with Japanese doctors, with the 2 foreign doctors as observers. Mostly they are just physicians, but for instance, in Shimada, they had a psychotherapist and paralegal to help filling out bunch of applications to be submitted to the Fukushima government. And all committee members, supporters, donors, exhibitors, volunteer staff of the day, and so on, made their efforts to make their event very successful. Unfortunately, we had a very short notice, so we could not get as many people as we first anticipated to the event. On page 4, I have data for the event. How many people attended, how many doctors met with how many patients. And as you can see very clearly, Yokohama had very many people for the health consultation sessions. 50 families came. There are more walk-ins, but we have to turn them out, unfortunately, because of the time constraints. And also we had only 6 doctors and dentists for the sessions. And Yokohama is not as badly contaminated as eastern part of Tokyo and Chiba prefecture, western part of Chiba prefecture, but it is contaminated. And the soil contamination is about 300 to 400 becquerel per kilogram. So it is dangerous for even adults. But it's much better than Chiba, for instance, Kashiwa, Ichikawa, that area. So there is mini evacuation going on in Tokyo area, moving from Chiba to Yokohama. So the husbands can keep commuting to Tokyo. And the evening event was attended by about 200 people. They stayed until very late with great enthusiasm. And in Shimada, the local committee was led by 2 people who were involved in local medical advocacy groups. They draw about over 20 local doctors to the event. They sent notices to the notices for the health consultation to all mandatory evacuees from Fukushima living in Shizuoka prefecture through the government, local government. But none of them signed up for the health consultation, unfortunately. And we think probably the evacuees thought we were going to collect data but not provide any treatment whatsoever. The local committee didn't have a strong connection with the evacuees. So they think that was a challenge for them. And they are going to connect with the locally living evacuees. In Shimada, they couldn't get any help from local doctors. So they had 2 doctors, one from Gifu and another from Kyoto. So that is another challenge. But Shizuoka is also contaminated. And I'm personally from Shizuoka. And when I'm there for 3 months or 4 months, I start getting very sick. And last February, I started bleeding in the nose. And I have to go out of Japan for 10 days to get recovered. So there is a problem, health problem in Shizuoka as well. And Osaka is the third stop on the tour. And the local committee was led by debris activists, and we participated as part of the all-day-long event. A doctor evacuated from Saitama saw patients in the consultation. A mother from Tokyo area was in tears when talking to the doctor about the child's thyroid disorders. There were also talks by a journalist, assemblywoman from Koriyama, Fukushima, and evacuees, as well as a mini symposium with them. And Osaka has very many evacuees, and they had a very good doctors, Dr. Murata and Dr. Gochi in that area. Yeah, unfortunately, I have to say, many people from even Tokyo have thyroid problems already developing. It's not a problem only in Fukushima, but all the people who met with this radioactive fallout probably have some problem with the thyroid. And in Fukuoka, the fourth stop, the committee was led by Mr. Hara, who has been involved in the grassroots activities for many decades. In the mini symposium, evacuees from Fukushima and East Japan expressed their opinion against the government. Ms. Kazumi Watanabe, who was hosted by Human Rights Now last month, to talk about her mobile nursery project in Fukushima, was interviewed at the end of Fukuoka event. And in the evening, the committee presented Mr. Hiroaki Koide in his talk, which I interpreted for the both foreign doctors while they were taking notes. And Kitakyushu was the last stop for us. And Kitakyushu became very famous recently for the debris thing. They have very aggressive, very aggressive mayor. The local committee was represented by Ms. Satoko Murakami, who led the local debris actions against the city government. She was a housewife before she started hosting evacuees last year. Ms. Murakami expressed her intention to run for the city assembly after realizing that nothing would change in the city unless people could change the politics. The local doctor Kitagawa and the evacuee lawyer Saito participated in the mini symposium. In Kitakyushu and Fukuoka, many health effects were reported after the test burning of tsunami debris in Kitakyushu. So the health consultation for 10 families was filled up as soon as they started taking reservations. And the radiation problem, health problem, is spreading all over Japan now through burning debris from Iwate and Miyagi, and also contaminated food. Both foreign doctors participated in the IPPNW World Congress and the field trip in Fukushima, which was organized by Peace Board, and Green Action and other organizations. And they thought that they had sufficient information. But then they observed the health consultations on the tour and were very surprised to find out that actual patients were in even worse conditions than they had anticipated. The symptoms are always the same, as Dr. Ziedentopf said. On page 6, there is an interview with two doctors. I interpreted in this interview, and you can watch this interview on YouTube. This is the Japanese translation. And the symptoms are always the same, according to Dr. Ziedentopf. Nosebleed, skin disease, diarrhea, respiratory diseases, pains at the rear of the ears, stomatitis, and so on, as well as thyroid disorders. Although thyroid disorders in Fukushima had been much reported by the media, we found out evacuees from the Tokyo area also complained about thyroid cysts and nodules. Both doctors are very angry about the Fukushima prefecture government's handling of patients with thyroid disorder. That is, no secondary testing in 2 years. It is internationally agreed upon within the medical community to control such patients by repeated testing at least once in 6 months and every 2 months in more serious cases. Furthermore, it is widely talked that thyroid cancer started surfacing in Chernobyl 4 years after the nuclear disaster, and it is based on the data in Chernobyl. But according to Dr. Ziedentopf, Chernobyl did not used to have such precision devices for thyroid testing as we have in Japan right now. And the doctors in Chernobyl manually diagnosed thyroid cancer without any precision exam devices. The ultrasound devices were introduced in big cities in Chernobyl about 4 years after the disaster, and now they are equipped even in small cities. Dr. Ziedentopf emphasized on the rehabilitation project from her own experiences over 20 years of running a Chernobyl support group. She had her own small town in the suburb of Frankfurt get involved in the support project. And the group had about 1,000 Belarusians stay at private homes in the town in the summers and treated them for whatever medical treatment they could have during their stay. Thyroid disorders were very rare diseases at normal times. Therefore, there are not many thyroid specialists in Japan or in the world. And not many doctors can handle patients with such symptoms. In health consultation on the tour, we kept hearing about Japanese doctors who laughed at patients or did not listen to patients at all. It is supposedly because of the Japanese doctors' lack of knowledge and their pride, which prevent them from acknowledging such lack or their incapabilities. There is also a family issue. In case of voluntary evacuation, most families moved only mothers and children out of contaminated areas, with husbands still working at their old hometowns. The evacuees were really battered financially and psychologically. Then they must face their child and their own health issues. they need immediate assistance for psychotherapy and financials. We found out that doctors with radiation knowledge are needed nationwide in Japan, not only in contaminated areas. Japanese doctors with Chernobyl experiences are into Fukushima and do not pay much attention to other areas. However, we found out there are patients everywhere, whether they are evacuees from Fukushima or Tokyo or local residents. This is the reality of low-dose radiation. So what is the next stop for Voices for Lively Spring? The doctors' networks did make their kickstart in 5 cities. The local committees mostly are working to coordinate local doctors who are interested to support patients with radiation health effects. In addition, evacuee mothers groups are trying to locate supporting doctors in their new homes. I have also been prospecting supporting doctors. My next task will be to connect these networks within Japan. On the other hand, however, the evacuee support network is something to be done yet. There are already a nationwide support organization connecting local groups, but I don't think it's very efficiently working for people who were already evacuated or it's considering to evacuate. And also the top priority is, of course, evacuation of children in Fukushima. Mari just mentioned about the UN Human Rights Council meeting on October 31st. A group of Japanese advocacy group sent a mission to Geneva, including Mayor Idogawa of Futaba Township. And he was able to state that he had cysts in the thyroid only overseas. He couldn't mention anything like that in Japan. So this is the reality. And even adults, well, Mr. Idogawa is another young fellow, but he has cysts already in the thyroid. And now the prefecture government is testing children, but they are not testing any adults yet. So what's going to happen next year or the year after? I'm very scared. And there is a lawsuit for school evacuation project in Koriyama. No local lawyer is helping in Fukushima. Lawyers in Tokyo area got together and started this lawsuit. But it's still pending after over a year. There is also so-called share house. This functions as temporary shelter and rehabilitation venue. And share houses are popping up in Japan. I think these are 2 things that I can start helping with in my capacity. As Mr. Koide always says, we can start with what we can